Thank you, Mr. Speaker. Mr. Speaker, today I rise to recognize and commend the work of the Share and Care Cockayne Syndrome Network for raising public awareness of this disease. Cockayne syndrome, commonly known as CS, is an extremely rare genetic disorder that affects only several hundred children worldwide. But its impact on the families of these children is significant both emotionally, physically, and economically. CS was named after Dr. Edward Alfred Cockayne, a physician from London, England, who concentrated on hereditary diseases in children. He recognized this genetic disorder in 1946. CS is characterized by short stature and an appearance of premature aging. Children with this disease fail to gain weight or grow at the expected rate. These children have an impaired development of their nervous system. They also have an extreme sensitivity to sunlight. Even a small amount of sun exposure can cause sunburns. Other possible signs and symptoms include hearing loss, eye abnormalities, severe tooth decay, bone abnormalities, and changes in the brain that can be seen on brain scans. There is currently no treatment for CS, and most patients die in their childhood. The disease is caused by a gene mutation that is passed down from the patient's parents. Diagnosis is often delayed or missed altogether because of the rarity of this disorder, its progressive nature, and the significant differences between cases. Mr. Speaker, I would like to thank the members of this House for voting in the affirmative on designating the month of June as Cockayne Syndrome Awareness Month in Pennsylvania. I encourage the public to learn more about CS and the stories of the young patients that it affects. Mr. Speaker, one of the patients is my constituent, three-year-old Julianne Tompkins. She joins us on the floor this morning with her parents, Brent and Christina, and her grandmothers, Barb and Pamela. Will the five of you please rise? Tootie, as she is commonly called, was diagnosed with CS last year. Because her condition went undiagnosed for so long, she had to undergo 2 needless skull surgeries. Had there been more awareness, Tootie and her parents would have been spared a lot of pain. Brent and Christina, her parents, say that Tootie
Ladies, suspend a minute. If the members could kindly hold the conversations down. Appreciate it if you would clear the aisles. Kindly hold the conversations down. Go to the rear of the House if you need. Lady may proceed. I apologize for the interruption.
Thank you, Mr. Speaker. Brent and Christina say that Tootie has taught them never to give up and to cherish every day that they have with her. She has been through so much medically, and yet she remains strong and still has a smile on her face. Mr. Speaker, the Tompkins, along with the Care and Share Network, are working to raise public awareness about this terrible disease in the hope of someday finding a cure. I would like to once again thank this House for the affirmative vote on House Resolution 683. Thank you, Mr. Speaker.
Speaker, thanks, lady.